Good day, everyone. I'm David, moderator for this webinar. I welcome everyone for today's webinar, which is HIPAA and the identification of PHI, sometimes required, never easy. I would now like to introduce our presenter for today, Jim Sheldon-Dean. Jim Sheldon-Dean is the founder and director of compliance services at Lewis Creek Systems, LLC, a Vermont-based consulting firm founded in 1982, providing information privacy and security regulatory compliance services to a wide variety of healthcare entities. He is a frequent speaker regarding HIPAA. Sheldon-Dean has more than 2 decades of experience specializing in HIPAA compliance, 4 decades of experience in policy analysis and implementation. I would now like to hand over the floor to the speaker. Over to you, Jim.
Thank you very much, and welcome everybody to today's session, looking at protected health information and how you go about de-identifying it. How can you take that information that is identifiable and make it something that is not identifiable to use it for other purposes? So we'll look at what HIPAA calls for and what's called for in other kinds of research and various discussions. It's actually a pretty fascinating topic. So we'll look at what the HIPAA requirements are for de-identification. And we'll talk about what is the rationale for de-identification. Why would you want to do that? What are the reasons why you'd think, I have this information, I'd like to use it for some purpose, but it shouldn't have the identification for it. What can you do? And what is the standard under HIPAA? What are the things that you need to do to officially de-identify information under the HIPAA regulations? There's some things that the regulations mention. In particular, there's a couple of methods you can use for doing de-identification. It's like I say, it's kind of an interesting topic compared to a lot of the regulatory stuff that you can talk about when it comes to HIPAA. What are we talking about today? We're talking about the HIPAA privacy, security, and breach notification rules. That's really where this all wraps up. So we're looking at protected health information and uses and disclosures. What is this of PHI? Now, there are various required and permitted usages and disclosures. You must disclose to HHS if they have questions for you about compliance. Other allowable disclosures have to do with where it's required by law or public health activities. So it is a privacy rule foundation. It needs to be considered by both those requesting and providing information. So what is de-identified data? Pretty obvious ones here. We have, name and address, including your city and zip code, telephone number, fax number, email address. If you're looking for some guidance, official guidance on de-identification, there's some from HHS that came out in 2012 is identifying information PHI. So when it comes to, how do you identify an individual in correspondence to this? Now, a limited data set, like I mentioned, a limited data set is partially de-identified PHI. It's still protected. That is collected and used solely for research purposes. It's not PHI. Now, when it comes to if you're a business associate working with covered entities, now, so when it comes to the impact of HIPAA on researches, in 2013 they had some changes in the rules for research. So anyway, if you plan to do an identification of your data or create any limited data sets, so there's a number of other policy requirements you need to consider when it comes to de-identification. So we're going to get into the fun part here. Now, when it gets into de-identification, so now when it comes to the expert determination method, part of the question is, who is an expert? Okay, so like another question that we're thinking about is, what is the acceptable level of risk? We're talking about reducing risks to an acceptable level, the risk of re-identification. Okay, so you have a blood test record. The data source availability for this blood test example is, so when it comes to assessing the risk, now when it comes to identification risk, so when it comes to assessing the risk, when it comes to various approaches to mitigating risk, now, the safe harbor method also, you want to also remove all elements of dates except the year for dates that are directly related to an individual. And of course, all those other things we mentioned before in that list, the telephone numbers, fax numbers, email addresses, social security numbers. And so the guidance, we want to make sure you're careful with dates and things like that, but the guidance says that, there are a few things you want to be careful of. The guidance says using initials instead of a name is not good enough. You need to make sure you're careful with dates. And what constitutes any other, we talk about the any other unique identifying number, characteristic, or code. And that what is the actual knowledge that the remaining information could be used? That's, actual knowledge. Other safe harbor issues are in there, things like, names of others like doctors or the workforce. So what can go wrong? Okay, what can go wrong? How can things go wrong? Well, there's plenty of things that can go wrong. There's lots of, challenges in the identification of medical text, as I've alluded to. Medical records, now de-identifying photographs and video, those are the kinds of things that, that we need to think more about these days, especially now that we've realized these days when you go through modifications to photographs and videos to try and de-identify them, HIPAA breach may be any acquisition, access, use, or disclosure. So when it comes to de-identification of breaches, that's when you're looking at, is there a reportable breach or not? You have to look through and ask some questions. Okay, so based on what the analysis is that we have to do, we were just talking about, there's a link you can go to to report them either large or small. So the idea is you have to learn from past breaches if you can. I mean, there's so many things that have happened in the past. Let's see what can we learn from all that. They can have certain penalties that can wind up in the over $1.7 million range. So let's think a moment about what your to-do list is. What your to-do list is here going forward. You want to be able to, first of all, review how you use and share PHI. If you're sharing it for certain purposes. So again, thanks for listening. I do appreciate you taking the time to go through this presentation. And I hope it provides some insights to you for the consideration of how to properly de-identify health information under HIPAA. So again, thanks for listening, and please enjoy the remainder of your day.
Thank you, Jim. That does conclude the session for today. Thank you, everyone, for participating.